Her name was Roxane. She lived in Illinois. She noticed her left breast was swelling. Not a little, a lot. She thought she'd strained something at the gym, or maybe it was a change after breastfeeding. She waited. The swelling came back. So she went to her surgeon. He looked at her, and he said, "BIA-ALCL is so rare, you don't need to be tested." She insisted. She pushed back. She said, "Test me anyway." The result came back positive. She had cancer inside her breast implant, growing for years. And the first doctor she told sent her home. I'm Dr. Chen. I have spent years studying what happens between a woman getting implants and the moment something goes wrong. And today, I need to tell you something that 38 countries knew before the United States did. Something that might be sitting inside your body right now. Let me start with the simplest possible explanation. Every breast implant, silicone or saline, gets surrounded by a thin layer of scar tissue. Your body builds it automatically. It is your immune system doing its job, walling off something foreign. That scar tissue and the fluid inside it, that is where the problem begins. For most women, nothing happens. The scar tissue stays quiet. Years pass. Everything feels fine. But for some women, in that fluid, in that scar tissue, something starts to grow. It is called BIA-ALCL. Say it once. Breast Implant Associated Anaplastic Large Cell Lymphoma. Now forget the name. Here is what matters. It is not breast cancer. It is a cancer of the immune system. It grows not in your breast, but in the fluid around your implant. And here is the fact your surgeon probably never told you. It takes an average of 9 years to appear. 9 years of silence. No pain, no warning, nothing that feels different from a normal day. Then one morning, swelling, fluid, a lump. And by then, it has been growing for nearly a decade. Have you ever been told this number, 9 years, before signing a consent form? Write yes or no in the comments. I want to know how many of you were. Now here is the part that changes everything. Not all implants carry the same risk. The difference between an implant that is dangerous and one that has 0 confirmed cancer cases comes down to one thing. The surface. Run your finger across sandpaper. Feel the rough texture. The thousands of tiny raised points. That is what a macro-textured breast implant looks like under a microscope. Those textured implants were designed with good intentions. The idea was simple: rough surface grips surrounding tissue. Implant stays in place, less chance of rotating or shifting. What nobody told patients, and what the research showed later, is that rougher surface means more space for bacteria to settle. More bacteria means more inflammation. More inflammation, in the wrong body, with the wrong genetics, can eventually trigger cancer. Here is the number that stops everyone cold. Allergan BIOCELL implants, the most textured on the market, 1 confirmed cancer case for every 3,817 implants. Mentor Siltex, a different brand, also textured but less aggressive, 1 case for every 60,000. That is a 15-fold difference between 2 products that were both sold as simply textured implants. And that last figure, smooth implants, 0. Not a smaller number, 0. As of today, there is not 1 confirmed BIA-ALCL case in a woman who only ever had smooth implants. Not 1. That fact was not in the paperwork most women signed. I want you to look at this timeline, because it is not about science, it is about decisions. 1997, first case documented. 2011, the FDA says there might be a link. Does nothing. 2015, a published study confirms it is the texture. The science exists. 2016. The World Health Organization makes it official. 2018. The Netherlands bans Allergan implants nationally. April 2019. France goes further than anyone. Not one brand, not one model. The entire category of macro-textured implants banned from the French market permanently. July 2019. The United States acts. 8 years after its own first warning. 38 countries ahead of it. I am not here to blame any regulator. Every country has its own legal and scientific process. But I want you to understand one thing clearly. The information existed. The research existed, and for 8 years, women were still receiving these implants without being told. Here is something that almost never comes up in a consultation, and it is the reason some women are at higher risk than they know. Certain genetic mutations dramatically increase BIA-ALCL risk. Published in July 2025, just months ago, researchers at Memorial Sloan Kettering found that women carrying BRCA1 or BRCA2 mutations face nearly 5 times higher BIA-ALCL risk when they have textured implants. BRCA mutations are the same ones associated with elevated breast cancer risk. Many women know they carry them, many do not. If you carry a BRCA mutation and you have textured implants, that is a conversation you need to have with your surgeon this week. Not next year, this week. Ask directly, given my BRCA status, should we be monitoring my implants differently? That one question could change everything. Let me give you 4 specific actions, not vague advice. 4 things you can do before this week is over. Action 1. Find your implant card. It is a small card your surgeon gave you after surgery. It has your implant brand, model name, surface type, and lot number. If you cannot find it, call the clinic where you had surgery and ask for your surgical records. This is your legal right. In the UK, under the Access to Health Records Act, in Europe, under GDPR, in Australia, under the Privacy Act, in the US, under HIPAA, you are entitled to this information. Go get it. Action 2. Identify your surface type. If your card says smooth, your risk based on current evidence is effectively 0. No confirmed cases. If it says textured, find the brand. If it says Allergan BIOCELL, call your surgeon this week and ask, what should I be monitoring for and how often? Action 3. Know these 4 symptoms. Sudden swelling in one breast. A new lump near the implant or armpit. Unexplained pain that is new. Skin redness or thickening near the implant. These symptoms can appear 2 to 28 years after surgery, not 2 weeks. 2 years to 28 years. If something feels different, do not wait. Do not assume it is normal. Action 4. If you are planning augmentation, curious, ask your surgeon one question before anything else. Will you use smooth implants? Not textured, smooth. Because that single choice eliminates the risk entirely based on current evidence. I want to come back to Roxane. After her diagnosis, she spoke publicly. She said something that has stayed with me. She said, I learned about BIA-ALCL from Facebook, not from my surgeon. Think about that. A woman found out she had cancer risk from a social media post, not from the person who put the implant inside her body. She is not alone. Jennifer Cook, a teacher, got textured implants in 2010. Her consent form said there was no scientific evidence linking implants to cancer. In 2011, 1 year later, the FDA announced the link. Her form was never updated. She spent years fighting for a diagnosis. 2 surgeons dismissed her. She finally went to her OB/GYN, who referred her to a specialist, who finally found it. These are not rare stories. They are the pattern.
According to the International Society of Aesthetic Plastic Surgery, over 10 million breast augmentation procedures are performed globally every year. 10 million women. Every single one of them deserves this information before surgery, not 9 years later. Here is what I want you to remember. A surgical recommendation is not a verdict. It is the beginning of a conversation. You walked into that clinic as a patient, but you are also a participant in your own care. You have the right to ask every hard question, to request your records, to push back when something feels wrong. Roxane insisted. It saved her life. You can do the same. Find your implant card. Know your surface type. Know your symptoms. Know your rights. That is not fear. That is power. Next week, rhinoplasty revision. Why 1 in 7 women goes back for a second nose surgery. What surgeons get wrong the first time. And the questions you must ask before any procedure on your face. Confident, I am Dr. Chen for the aesthetic truth. Take care of yourself.